So we change totally of topic. And sorry for the start of my lecture because technical problems are not previsible. So we will speak about a very, very specific vision of health, because, you know, in traditional Chinese medicine, they speak about the concept of sub-health. It's the first time this topic is developed during a congress, because with the COVID period, you can understand, a lot of presidential congress were cancelled. And today I have a big honor to show you that just a new way, a new vision of the health, and the different ways to access to a top level health. Okay, next one. So my way is easy. I was osteopath. I am osteopath since a very long time, bionutritionist, UMB director, academic director of the course in university, and a member of the scientific committee in the National Health Chamber. So you have my email down. Next one. The treatment for the actual symptom. So the TCM practitioners must consider emerging diseases, because you know that in traditional Western medicine, a lot of patients have problems, and the doctors and the common specialists in France, for example, in Switzerland, in all the countries, Western countries, don't really understand what happens. He must refine his diagnosis to resolve cases in a sustainable way, and differential diagnosis is sometimes very complicated. Next one. So, the TCM must remain the basis for diagnosis. The purpose of this presentation is to consider the differential diagnosis from a new perspective and new vision. Tradition now has the possibility of using computers to refine the diagnosis. All of you understand very well, because we are speaking every year around biophotonics, electrophotonics. And computer science is turned relays on tradition for knowledge in TCM and in Ayurveda. Next one. So, healthy patients, the misunderstood of our medicine, that is a big problem. Why some patients have small problems and they are not understood by the medical doctors, by the specialists, because we don't find anything in the common analysis. They often have ill-defined symptoms. The origin of their disorders can be, for sure, multifactorial. Biological analyses are very often normal. Organic functional disorders are not constant. They often describe discomfort of pain, or for example, some pain here, and I will give you some examples. And conventional medicine often puts them on antidepressants, because when we don't have explanations about some stage of illness, some disease, our Western medicine find the shorter way, the shortest way to give some antidepressants. So next slide. Towards a new medicine unknown to official circles. Do not forget that we are electromagnetic beings living in an electromagnetic world. What are the consequences of this? How can we effectively address this issue with our patients? Towards an elaborate protocol, we will speak about that. Next one. So, just a feedback, a very short feedback. All of you know the history of electrophotonics, but we will pass very rapidly on that. You see, a long time ago, researchers through the world worldwide found the link between the electrophotonic, I mean a sort of excuse me, the human energy field and the disease. Because today with, for example, GDV or BioWell, we can find the way very fast compared to the past. Next slide. So our body are constantly emitting electrons and photons. We have a very express energy balance that takes maximum 2 minutes, 1 minute with the BioWell if we are going fast. More than 80% correlation with the conventional checkups. That is big interest for the conventional medicine vision. And we have a predictive range, but it's difficult to match. Next one. So we will pass very rapidly the slide. You know the picture. Next one. You see, we can do the link between the different medicine. We can. Next one. Next one. We can speak about alternative medicine, complementary medicine, integrative medicine, holistic, systemic medicine. Next one, and energy medicine. And BioWell is in the center of all of them. Next one. So that you know this picture. Next one. You know the process how the electrons discharge and with photons manage the final pictures on our computer. You know very well this drawing. Next one. And we enjoy of different vision of the health, looking for different approach like traditional Chinese medicine, Ayurvedic medicine, Western medicine, and BioWell always do the link between them. Next one. So TCM principles. Here it is more about sub-job in Korean medicine, but the system of meridians more or less are the same. Next one. We have different programs at our disposal. Next one. Next one. Next one. Let's see next one. Next one. Next one. Next one. Next one. And next one. So the biograms are very interesting for a specialist in electrophotonics, because when we know very well this approach by the time, we can in the first second have an idea of the stage of our patients. Because when you have a lot of problems in the energy of the patients, you can see very bad biograms. For sure, if you put the filter, you could have better pictures, but at the end, do not forget that the patients are living, we can tell, without filter, because they are living with the mind, with the emotions, with the memory of emotions, and it's very difficult to put out that definitively of the mind of the people. Next one. So you know the report at the end. Next one. And you know the table, Dr. Korotkov. You know, you have all this table in the BioWell system. Next one. So, the foundation in the process. The notion of total energy, we will see that below. The TCM approach, the biophysics, and the energy medicine. Next one. So, we will speak about very fast global energy. You should know that we all have a particular and stronger or weaker organ depending on our own constitution and, for sure, present time. Our energy level often depends on the weaker organ. For example, I don't know, if you have, for example, liver crisis after a big fast, all your body will be at the level of your liver. You cannot be stronger, but your liver, if your liver is very low. You understand? All of you understand that. The BioWell allows to evaluate organs' energy, and now let's see the following clinical situations. So this very simple drawing explains us how it works. Look, on the left side, you have the energy of the different organs. In this drawing, you can see the kidneys very top level and the lungs very low. You see, and this line with a small pieces of line, you see, the very fine line, is a starting of disorders or disease, you know. And when you have a normal health, for example, the first column, all is okay. The lungs are low, but it's okay. It passes, okay? But when you have a loss of energy, what happens? The lungs are coming down, and they start to be in bad position or in bad situations. So what do the classical medicine? They give special treatments, I don't know, antibiotics, some cortisone products, what I want, and after, the patient seems to be better. I just tell seems to be better. But when the next disbalance will come in the time, same process, the energy, excuse me, of the lungs will go down, and he will have a new problem. And that is during all our life, it is the same process. If the energy is in a height, it's okay, it will pass. If the energy is borderline or limited, it will go down and we will develop a pathology. Okay, it was just an idea through this drawing. Next one. So it's just to repeat a little bit what I told you just before. There is a limit energy level specific of everybody below which the organ cannot work properly. Reaction if vital energy collapses and the disease is located in the lung at the end. You understood that very well. Next one. So if you use a symptomatic treatment, the patient's energy rises above the critical limit, but the overall energy level remains unchanged. This leads to an artificial situation. It's not possible to have a sustainable situation in the time because the energy is too much borderline. Risk of relax in case of down energy. Next one. The major advantage of the electro-biophotography. You know very well, very quick examination. If you teach before the patients, you could pass all your measurement in 1 minute only, maximum 2 minutes. Next one. Non-invasive, for sure. It's difficult to do less invasive. And very big advantage, the possibility of detecting pathologies presented at the energy level and not appearing on clinical or cellular level years before the pathology. And with my experience in biophotonics since 23 years, because when I started biophotonics, that was not with GDV, but with a very special prototype in 1999. It's very far, it was with a prototype, but every time at the end, the conclusion is the same. when you see specific signals, very aggressive signals on special organs or system in the time. If you do not anything to help the patients will have problems. Next one. And possibility to bypass the stages of induction. That is like a miracle. We will be able to do that, and we will teach that in Aragon in September, because I will show a very easy way based on TCM. It is the transmission or transmitting the chi. And you know very well what is chi, what is energy, and the simple transmission of chi on a person could move immediately the human energy field. Next one. So, conclusion, disease is not inevitable, resulting from accumulated stresses. We must know our energy imbalances to understand where we need to work to be able to maintain top level health, and they should be corrected as soon as possible. Next one. So, two very rapidly cases, clinical cases, rapidly. Now, some pictures of significant cases. Gael case. Please look for the date and the hour. Look, Gael, it was at 4:12 p.m. The first picture, and the second picture without filter. The both are without filter. It is less, almost 15 minutes later. Where is the difference from what it is coming, this difference of human energy field? Only by the next slide you will understand. I put to protect this man. Next one. I put in the wall this system of supply just to clean the room. And next one. And he was sitting on this earthing mat. And I have done the second measurement as you see just before. You see, and only doing that, the difference was huge. Just for example, you can come before, please, Dimitri, to the human energy field. You see, this young man was 32 years old. And if you can show the human energy field, Dimitri, please, just before, 2 slides before, you see during 12 years, this man had a treatment of anti-epileptic pills, 12 years long. And just giving him the advice to earth his body to the earth, for sure it's a pleonasm, never later he had such disease of epilepsy. Only with this prescription. It's totally incredible, but it is true. Next one. So you can see the meridians on the old program, because you know today we have 2 columns of meridians. The meridians before absoplug connection to the wall and earthing and next one, and after the connection to the earth. It's immediate results. Next one. When we see the blood of these people, because I work with some medical doctors who have this system of electronic microscope to see the cells, the blood cells, you can see what happens with cells. It is only a system of magnetic polarization, and what happens? The deficit in oxygen is going up, and the people have a lot of problems. But the conventional exams don't show that, you see. So next one, you can check your oxygenation in blood with this type of device. You know, it's very cheap. Next one. So just an example, human energy field after 15 minutes talk on mobile phone, you can understand what happens in your body. And who has not mobile phone today? Impossible to answer because everybody has mobile phone, but the people don't think to that, and they use that many hours per day without big care. Next one. The different AMF effect on the body, you can be sure that you will have chronic fatigue, nervous and muscular tensions, headache, concentration problems, sleep disorders, dizziness, feeling of tightness, heart rhythm problems, latent depression, and general and unexplained malaise. That is worse because all the people who have that go to the doctors, the conventional doctors, and don't have answer to their problems. Next one. So all this contributes to the gradual establishment of the state of substance. Medical practice are full of them. They remain not understood by almost health care providers. They have misdiagnosed and therefore poorly treated, for sure. It's normal. They often enter a medical wandering with no way out. We, holistic therapists, all our group, must take care of them, please. Next one. Beata cases, it's a woman, beautiful woman and young, very young woman. Look the hour, please, 6:07 p.m. and 6:13 p.m. Where is the difference between the two human energy field? Same way, please, next one. Apps plug in the wall in my office, and next one, earthing. And you saw just before the difference of energy in all the body. Since 23 years, I do a lot of checking on people, checking every day with a lot of doctors. For example, here I am with 100 persons, a lot of doctors, etc. And I check all the day in different situations. When you put the connection to the earth for people, the people increase the energy, increase the balance of meridians, increase the size of chakras. It's incredible. So if you have a good earth in your home or in your office, you can try and you will see. Next one. So you see the meridians before and after, please, and you will see the difference. You see a lot of green after, a lot of green in the meridians way. Next one. So after, for sure, all of you know this way of treatments on the energy of the body, effect of biocore session, binaural sounds. Next one. You will have the package on the website of BioWell. Next one. And you can see before and after the music of biocore. For sure, here was not a big result, biggest result we had, but just to show you the difference after 9 minutes of music, biocore music. Next one. So now, last advice for you, please mind your house. Daniel Kovacic research in Sao Paulo, Brazil, give us an interesting way to mind to our health in relation with our house and office, for sure, because we spend a lot of time in office. This approach largely explains the negative impact of water systems soiled by feces and when they pass and cross our living area. Even more, or if it is a question of the bed, the sofa, or the workplace workstation. Let's look at some explanatory diagrams. Look, next one. That is just, it is just an idea to understand what happens. when you have salt water with feces, you have a septic tube crossing in the ground. Next one. If you spend several hours a day, several days a week during 2 years, you could have problems. But at the start, it is not a big illness. For sure, it's, you are just tired, you understand why, etc. You don't understand why, because all your life is normal out of this problem. And this problem is down the ground, down your house. Next one. And you see the places in the house, you know them. A bed, a sofa, a working place, etc. Next one. You can imagine down the red line, you could have a tube with dirty water. And if this water is coming from toilets, for example, it crosses, for example, on the left side of the bed here. And if Madam is sleeping here, Madam will be very tired and Mr. no. Why? Because it's a difference of energy at the vertical of the dirty water. Next one. Same for that with the sofa, you understand? Next one. So, conclusion. Where does the disease manifest itself? Usually in the weakest part of organ of the body. Taking into account the different parameters that can affect vitality and the energy field on a daily basis is a must to recover perfect health and to forget definitively the sub-health. Because for me, actually, in our century, I can ensure you that we have a link between all these pollutions and our health and balance. Thank you to Be Well for allowing us to do this. Next one. So you could have more information about the Daniel Kovacic approach on this website, please. It is coming from Brazil, BR, and it is a top-level website showing many cases of problems, big problems, cancer, etc. Next one. So if you need more information at the end, you can write me on this email. Thanks a lot for your attention. Next one and the last one. And thanks to you all for your interest and attention. Thanks you to the Congress organization to offer a fast track between traditional medicine and tomorrow medicine. Thank you to invite an audience of such great quality, and see you soon in our different seminars. Thanks a lot.